Here's a brief overview. Ensure that the basic ABCs of airway, breathing, and circulation are intact prior to any splinting activity. Expose any injured areas. Observe skin color and symmetry. Assess and document pulse, motor, and sensory function. Apply constant yet gentle long axis, that is, in-line manual traction on severely deformed long bone fractures. Return extremity to its normal anatomical position with an assistant supporting the extremity under the suspected fracture site. If the patient complains of increased pain, or if there is resistance during manipulation, then stop and immobilize the extremity as best as possible in the position found. Maintain manual support of the injured area while coordinating additional assistance during the EVAC-U-SPLINT immobilization process. Your healthcare partner or a qualified assistant should apply appropriate dressings to all wounds in and around the suspected fracture site. Open the EVAC-U-SPLINT carry case and select a splint that will immobilize the joints above and below the fracture site. Shoulder and hip injuries will require additional immobilization methods to accomplish this goal. Remove the red leashed cap from the maxi valve and push in on the red end of the valve to equalize the air pressure in the splint. Lay the splint out on the ground and manually distribute the beads evenly throughout the splint. The EVAC-U-SPLINT should be soft enough to easily and comfortably conform to the injured area, yet firm enough to keep the beads in place if positioned vertically. This adjustment method can easily be made by simply removing or allowing air to enter the splint. Maintain support of the injured area and elevate, if indicated, the injured extremity just enough to apply the splint. Slide or place the splint under the injured area, positioning the splint so that at least one strap is above the suspected fracture site and at least one strap is below the suspected fracture site. Cradle the injured extremity with the splint and gently manipulate beads into voids to provide the best conforming mold possible. The splint should conform easily. If not, simply adjust by allowing air to enter the splint. The splint edges should not overlap. Tip: leave an open space approximately 1 inch whenever possible along the length of the splint. This provides proper mobilization, yet also allows for visual inspection along the full length of the injured extremity. If the splint is too wide, fold the strapless edge back on itself and smooth out the edge to form a narrower splint. Hold the splint in place hands-on stable by grasping both top leading edges above and below the fracture site. Once the splint is properly applied, release your support of the extremity, letting the splint cradle the suspected fracture site, still though assisted by your partner's hands-on stable support, which maintains the injured limb in a desired and comfortable position. Remove the red leash cap from the maxi valve and push in on the red end of the valve to equalize the air pressure in the splint. While holding the flange tubing on the splint, connect the maxi valve female coupling on the pump hose to the maxi valve on the EVAC-U-SPLINT. You should hear a click when the connection has been made. If you are using a portable suction device, connect the maxi valve portable suction adapter, or PSA, to the end of your portable suction tubing. While holding the flexible flange tubing just below the maxi valve, attach the vacuum pump hose with adapter to the maxi valve. Evacuate the air from the splint until the splint forms a rigid cast around the injured area. You will feel resistance on the pump handle when the splint has been sufficiently evacuated. Remove the pump hose from the maxi valve by depressing the metal tab on the female coupling. Place the red leashed cap back on the maxi valve. Simply pull on the red end of the hook and loop straps to extend the strap. Place the splint straps with slight tension around the splint. Secure the straps in place. Note: the EVAC-U-SPLINT is available with hook and loop or side release buckle straps. The hook and loop straps are shown here. The suspected fracture site is now splint stable. Adjustments can now be made if necessary to add stability or to make slight positional changes for patient comfort. These adjustments can be accomplished by simply removing or allowing air to enter the splint. Continue to monitor circulation and sensory functions en route to the medical facility and make further adjustments if the patient condition changes. Here's another tip. During aeromedical transport, the splint may soften slightly with a significant increase in altitude. Adjust as necessary. The change in rigidity will not be nearly as noticeable as with anti-shock garments because there is very little air inside the EVAC-U-SPLINT once it has been evacuated. Finish treatment of the patient with the appropriate EMS equipment and supplies based on the patient's needs. Unfasten the attached straps prior to allowing air back into the EVAC-U-SPLINT. Do not cut the EVAC-U-SPLINT or straps. Please make sure all hospital personnel are informed about these removal procedures. Remove the red leash cap from the maxi valve, and while holding the maxi valve, depress the red plastic center section, allowing air to enter the splint.